Let's talk about calcium channel blockers for a few moments. Now, calcium channel blockers are one of the few drugs that I really want you to focus on studying for the NCLEX, because calcium channel blockers are one of those classes of drugs that lots of other new grads know. So like all other content on the NCLEX, if everyone else knows it, then you ought to know it also. All right? So let's picture this scene. You are sitting on the beach, and right next to you is your very best friend, the calcium channel blocker, sitting on that beach chair right next to you. Now, when you are on the beach, you are chilling out, right? This is a time when you are maxing, relaxing, and just enjoying yourselves. This is a time to chill out. And on the beach, you and Mr. or Mrs. Calcium Channel Blocker are listening to reggae music. You and Mr. Calcium Channel Blocker are just chilling out, because that's what calcium channel blockers do for your heart. They help your heart relax. Your heart is not listening to rock music or techno music or something wild and crazy, while calcium channel blocker is there helping out, right? Calcium channel blocker brings the reggae music to your heart, right? And there's basically two different types of drugs that affect your heart, right? There's things that help your heart chill out. Calcium channel blockers fall into that category. And then there's things that help excite your heart. Great example of a drug exciting your heart would be epinephrine, right? So this is acting opposite of epinephrine, and it's helping chill out your heart, right? So there's three things that describe the different actions of your heart. Ionotropics are things that affect the strength of the beat, right? Chronotropic are things that affect the rate of your heartbeat, and dromotropic are things that affect the conductivity of your heart, right? So there's two classes. You have positives and you have negatives, right? So the positives, the drugs in this class, are considered cardiac stimulants, right? Again, epinephrine would be a cardiac stimulant. That's a drug that is going to help make the strength of the beat harder. It is going to make the rate of the beat faster, and it's going to make the heart more excitable. Right? Now, negative drugs in this class are cardiac depressants. Okay, so that's what you can write in the dashes down there. And the drugs in this class are cardiac stimulants, are the positives, and then the negatives are cardiac depressants. And a cardiac depressant that's very commonly used are calcium channel blockers, right? They make the strength of the heartbeat weaker, they make the rate of the beat slower, and they make the conductivity speed of the heart slower, right? So why do we use them? Okay, we have three different primary reasons, and they all start with an A. Okay, we have an A, and then two A's and triple A. For A, they are antihypertensives, okay? So to reduce the blood pressure of a patient or client. That's why we would be giving a calcium channel blocker. The second would be for anti-angina. So they're anti-anginals, and they help with chest pain. And that happens because calcium channel blockers vasodilate blood vessels, and they decrease the oxygen demand of the heart. So think of it in terms of your whole body. If you are running, do you need more oxygen than if you are walking? Absolutely. So if your heart is racing, it's going to need more oxygen. But if you have an occlusion that is keeping your heart from getting adequate blood flow, that's going to cause that angina. Right? So if we can slow your heart down, it needs less oxygen, and it's going to help relieve some of that angina pain. Right? So the third thing, the AAA, anti-atrial arrhythmias. Right? It's used to treat anti-atrial arrhythmias. So when it comes to treating arrhythmias, they don't touch ventricular arrhythmias, just atrial arrhythmias. Okay? So AFib, aflutter, premature atrial contractions, these are things that are going to be treated by calcium channel blockers. So if it's ventricular anything in terms of arrhythmias, calcium channel blocker is not going to treat that. The one thing you want to watch out for, though, is to know your vocabulary, because you might see SVT or supraventricular tachycardia. Well, it says ventricular in that phrase, right? Supraventricular tachycardia, but what does supra mean? Supra means above, right? And so a tachycardia starting above the ventricles is starting in the atria, okay? So that is the one exception to that does not start with an A, right? So what are some of the side effects that we need to look out for? Okay, what do we need to teach our patients about when they may be starting on one of these drugs? Because of the vasodilation, a lot of times patients will experience a headache because those little blood vessels in your brain start to dilate and you're going to get a headache. The other thing is, what is their role? We're primarily using to cause the heart to chill out, right? So when the heart chills out, you got to watch for hypotension, okay? So the first time we start somebody on this drug, what should we be watching for? What do we need to check before we give them this medication? Okay, you need to get in the habit of always checking your patient's vital signs prior to giving them medications. You need to know where they are at this point in time, okay? Not their vital signs, hours ago, but if somebody runs bradycardic and, you have an order for calcium channel blocker and it comes due in your orders, you need to think to yourself, should I be giving this drug to this patient if they are running hypotensive, right? So the effects on your patient's blood pressure, you want to hold this drug if their blood pressure is below 100 systolically, all right? So if the first number of their blood pressure is below 100, you don't want to give a calcium channel blocker. Now, if somebody's running in the 120s and they have been therapeutically being treated with a calcium channel blocker, you don't necessarily want to hold it if it's in that lower range of normal, because it's possible that that's the therapeutic result of using that drug on that patient. So they may be at 110 and you think, wow, maybe I should hold this drug or talk to the doctor about it. And if there's other indications that make you feel that way, then you always want to go with your gut and double check. But don't be too alarmed if you talk to the doctor and he says 110, yeah, fine, give it to him. 103, fine, give it to him, because we expect this to treat the hypertension of our patients. And if that's where they are at this time and it's being therapeutic, then we're going to give it. All right. Now, how do we know if we're dealing with a calcium channel blocker on the NCLEX? Because it's not going to say calcium channel blocker. It's going to give you a drug, and you need to know that it's in the class of calcium channel blockers. So these drugs typically have two different endings, except for verapamil, right? That's the one exception. But these drugs all end in ZEM, Z-E-M, or in dipine, D-I-P-I-N-E. So you have diltiazem or cardizem, or in the dipines you have amlodipine, nifedipine, felodipine, you have nicardipine. Okay, so these are all drugs that are calcium channel blockers. They all end in dipine or zem, with the exception of verapamil. Right? So if you know those two endings, you know about 15 different drugs and are going to be able to answer all different types of questions about calcium channel blockers. Okay? And don't forget, when we talk about critical thinking, what are some things we're going to want to teach this patient if it's a new prescription of a calcium channel blocker? So you say you work in a clinic or you're in a hospital and a patient comes in and they have a new prescription for a calcium channel blocker. One of the main roles of nurses is to educate our patients, okay? So the physician's going to tell them, we're going to give you a drug to help with your blood pressure. Well, what are we going to teach this patient about this drug? We're going to teach them that it's possible that they're going to get headaches from it. We're going to teach them that they need to watch for signs of hypotension or for shock, okay? We need to tell them when they should take it and when they shouldn't take it. We need to tell them that they need to monitor their blood pressure to see if the drug, number one, is being adequately therapeutic or overly therapeutic. We want to make sure that when we're giving them this drug, that they are experiencing what we expect them to prior to administration. So we expect them to have some hypertension or a normal blood pressure if they have been therapeutically receiving this drug in the past. But if we have a patient who has shock-like symptoms, would we want to give them this drug? Would we want to give them a calcium channel blocker? Well, if you have a person who's already super chilled out, would you want to give them reggae music? Or would you want to, give them something that's going to excite the heart a little bit more if they're having shock-like symptoms, right? So no, you're not going to give a person who's experiencing shock-like symptoms a calcium channel blocker, right? So remember, the big takeaway from calcium channel blockers is this picture in your head. You are on the beach with your buddy calcium channel blocker and listening to some reggae music, and you are maxing, relaxing, chilling out. Okay, that's what calcium channel blockers do to your heart. They help it slow down and chill out. Right? So that's what you need to know to rock out any questions that you may get on the NCLEX about calcium channel blockers. And while we're talking about calcium channel blockers, I also want to talk about another drug that is not a calcium channel blocker, but I'm putting it on this lecture because it does a similar thing to your body as calcium channel blockers do to your heart. And that drug is baclofen. Okay, and baclofen is indicated as a muscle relaxer. Okay. So just like calcium channel blockers are reggae music for your heart, baclofen is reggae music for the rest of your body. Okay, it's a muscle relaxer. An easy way to think of and remember baclofen is that it sounds like you're on your back loafing. Baclofen, back loafing. So whenever you think of somebody loafing on their back, what are they like? Right? They're sedated, they're chilling, their muscles are all relaxed. What are we going to teach our patient about baclofen? Right? We're going to teach them, number one, no alcohol while they're taking baclofen if they're taking it at home, and no driving if they've taken their baclofen, because you don't want somebody on their back loafing while they're supposed to be responsible for operating a motor vehicle. They need to be careful if they're taking care of kids while taking this drug. So when mom's being discharged from the hospital with a 5-year-old child, that should raise a red flag that you need to teach them that they need to have somebody else care for the kids while they're taking their baclofen. Basically, kids under the age of 12 should be watched. They need to be taught that this drug is going to make them feel drowsy, right? As you would expect from a drug that's going to put you on your back loafing. And it's going to cause some muscle weakness, right? It's causing the muscle to relax, so it's not going to be as strong, and they may be a little weak on this drug. And so they're going to be prone to falls if they're on this drug, and then also, especially if they're using any sort of alcohol with it, which we're obviously going to teach them not to do, but alcohol will potentiate or increase the effects of baclofen. So we're going to teach our clients to watch out for that. So again, baclofen is not a calcium channel blocker, okay? Do not think of baclofen as a calcium channel blocker, but it does a similar thing to the body as calcium channel blockers do to the heart, right? So there you go. Remember, they do similar things, but the different parts of the body. And remember, they're not the same drug, but they act similarly. Okay. So when you're studying other topics on the NCLEX, you can look at things that do have similar effects to one another, or you can look at opposites. So looking at things that are opposite of one another, which is a good way to memorize different topics. And it's a good studying strategy that you can use to memorize different information. And that's it for calcium channel blockers and baclofen.